Yeah, do YouTube. Welcome back to my channel. My name is MelisamarIe, aka Student Nurse Mel. For those of you who don't know, now you know. Make sure you like, comment, and subscribe. You can go ahead and take some time to hit that subscribe button and the little bell right there on the side as well. So this video, you are going to be seeing my video upload for my head to chest assessment project and health assessment part 1. Because Chamberlain divides up health assessment into part 1 and part 2, the huge assessment assignment is divided into 2 parts as well. So usually you might hear it be called head to toe, but the head to chest is for the first part and head to toe is for the second part. So they took out a couple of key requirements for the first part, but they will all be required in the second part. So yes, you will see my video very shortly. The project itself can be very stressful because you have to hit every point that's on the checkoff list, or else you'll be marked incomplete and thus fail the class. And so there was times where I would do the entire recording and miss one word, like maybe I said discharge instead of redness, and I would have to redo the whole video. So in reality, it took me an entire day to record it over and over and over and over and go back through and review to make sure I actually hit all the points and stuff. So it was a very, very time consuming, demanding, stressful, irritating, annoying project, but it had to be done. So we got out here and we did it, you know what I'm saying? And on top of that, you guys know I just moved and stuff, so I didn't know where anything was. It was just a very stressful time, but I did get it done and I passed on my first go. Oh yeah, that's a good thing to note too. You only get 2 attempts to do it. So if you mess up the first time and you got to redo it, you only get one more attempt to do it. And if you don't do it, if you don't complete it properly, then you just fail the class and you got to retake it. That's a lot of stress. Oh, I'm tired. That's a lot of stress to keep on your head, but it's very doable. You just got to really watch yourself and practice. Just practice talking to yourself. I sat up in bed talking about some, cardiac regions, aortic region, second intercostal space, right of the sternal border, Erb's point, third intercostal space, left of the sternal border. I sat there and talked to myself through it until I got it over and over. All these screenshots of all of the attempts that I did because I recorded it so many times. I was so upset, just frustrated with myself for messing up and stuff. But yeah, here's my video. Hello, my name is Melisa Nelson. My D number is D411108892. I am performing my assessment return demonstration for NR302, Health Assessment Part 1. And I'm going to scan the room now. Okay.
Hello, my name is WAHGWAAN. I'm over the age of 18 years old, and I give Chamberlain School of Nursing consent to perform a recorded health assessment for grading purposes.
I am now going to begin my assessment by announcing my presence. Mr. WAHGWAAN, may I please enter?
Yes.
Hello, good afternoon. How are you today?
I'm well, how are you?
I'm doing pretty good. Thank you so much for asking. My name is Melisa Nelson. I am going to be your student nurse for today. I will be performing an assessment on you, and it'll take just about 15 minutes, and it'll be completely painless. So if at any point you feel any discomfort, please let me know immediately, okay?
Okay.
Okay, and the purpose of this assessment is just for general wellness, okay?
Okay.
At this time, I'm going to be providing my patient with some privacy by pulling his curtain, and I will also be performing hand hygiene. Mr. WAHGWAAN, can you please tell me your full name and date of birth?
WAHGWAAN, February 21st, 1993.
Okay. I am verifying my patient's identity with his hospital bracelet. Thank you so much. And do you have any allergies, Mr. WAHGWAAN?
Yes, fish.
And what happens when you eat or touch fish?
My tongue gets itchy and my throat closes.
Okay, okay. I am making note of this in your chart so your medical team is aware. I am noting that my patient has an allergy to fish. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced, can you please tell me what, if any, level of pain you are experiencing right now?
0.
0. Okay, thank you. Moving along, upon initial inspection, my patient does not appear to be in any acute distress. There are no signs of acute distress. His facial expressions are appropriate for the situation. His mood is calm and cooperative, and his speech is clear. Mr. Wedderburn, can you please tell me what city we are currently in?
Atlanta.
And what is the year?
2020.
And who am I?
My nurse.
And why are you here today?
For a health assessment.
Mr. Wedderburn is alert and oriented ×4. Can you please hold your hands straight out like this for me, please? Thank you. Patient's skin is even and patient's skin color is even and consistent throughout. Patient's skin is dry. Patient's skin is free of any lesions, wounds, or incisions. Patient does have 2 tattoos and hair bilaterally. Okay, can you pull your hands back a little bit for me? Thank you. Patient nails are pink. The color or the shape is round. The contour is even. Can you put your nails like this for me? Thank you. You can put your hands down. There are no signs of clubbing. Can you put your hands up again? Thank you. I am now assessing the capillary refill. Capillary refill is less than 2 seconds. Bilateral, you can put your hands down, Mr. Wedderburn, thank you. Capillary refill is less than 2 seconds bilaterally. Ms. Wedderburn, can you please smile for me? Can you frown? Can you puff your cheeks out? Thank you so much. Facial structure appears symmetric. You can stop, Ms. Wedderburn, thank you. Facial structure appears symmetric. I am now going to put on gloves to palpate and inspect Mr. Wedderburn's head. Head is free of lesions or infestations. I am now inspecting the external ocular structures. Can you just look at me a little bit? Thank you. I am now inspecting the external ocular structures. They do not appear to have any drainage or redness. They appear symmetric. The sclera is white. The conjunctiva is pink and moist bilaterally. Mr. Wedderburn, can you please look straight ahead to the faucet? Don't look away. Open your eyes, please. Pleura is intact bilaterally. I am now assessing the external auditory meatus on the left and right side. Can you please turn your head to the left? Or to the right, sorry. And turn your head to the other side. Thank you. Left and right external auditory meatus are without redness or drainage bilaterally. I am now going to perform the whisper voice test. Mr. Wedderburn, I'm going to say a combination of letters and numbers. I need you to repeat what you hear me say, okay?
Okay.
Thank you. Can you just cup your ear for me? Thank you. I am standing 2 feet behind my patient. A, B, C, 1, 2, 3.
A, B, C, 1, 2, 3.
Thank you. Can you switch ears? And I'm going to move to the next side.
LMN 4, 5, 6.
Thank you so much. Whisper test intact bilaterally. Now, Mr. Wedderburn, can you please push your nose, the bridge of your nose up and tilt your head back? Not so high, please. Thank you. Nose is without deformity, asymmetry, or inflammation. There is no redness or drainage present. Mr. Wedderburn, can you place a finger on your nostril like this and blow? Switch. Blow. Thank you so much. Nose has bilateral patency and there is no drainage present. Lips are pink and moist. Can you please smile? Smile hard. Gums are pink and moist. Can you please stick your tongue out? Tongue is pink and moist as well. Thank you, Mr. Wedderburn. Usually I would perform this next part of the assessment I would ask the patient to take his shirt off, but for the purposes of this video and for my patient's privacy, I will be performing the respiratory and cardiac assessment on top of his shirt. Upon initial inspection, patient is not using any accessory muscles to aid in his breathing. My stethoscope has been sanitized prior to this. I'm going to begin auscultating the anterior lung fields. Starting with the right upper lobe. Left upper lobe. Right middle lobe. Left upper lobe. Right lower lobe. Left lower lobe. Can you please turn your back so that I can auscultate the posterior lung field? Thank you, Mr. Wedderburn. I'm just going to move your hair out the way. And I'm making sure to avoid the spinal process area as I am auscultating the posterior lung field. Starting with the right upper lobe. Just breathe regularly. Left upper lobe. Left lower lobe. And the right lower lobe. Thank you, Mr. Wedderburn. You can turn back around now. Lungs sound clear bilaterally in the anterior and posterior fields. There were no adventitious sounds heard. I am now going to auscultate your cardiac regions. Start in the anterior field. I'm going to start by using the diaphragm side. And I start at the aortic region, which is in the second intercostal space on the right side of the sternal border. The pulmonic side, the pulmonic region, which is the second intercostal space on the left side of the sternal border. Erb's point, which is the third intercostal space left of the sternal border. Tricuspid, which is the fourth intercostal space left of the sternal border. And then the mitral, which is the fifth intercostal space left of the sternal border, mid-clavicular line. Here's his clavicle. Okay, now I'm going to listen to auscultate those cardiac regions again, this time using the bell side of my stethoscope, starting again at the aortic region, second intercostal space, right of the sternal border. Pulmonic, second intercostal space, right of the sternal border, left of the sternal border. Erb's point, third intercostal space, left of the sternal border. Tricuspid, fourth intercostal space, left of the sternal border. And mitral, fifth intercostal space, left of the sternal border, mid-clavicular line. Okay. S1 and S2 cardiac sound noted throughout the cardiac regions. No murmurs were detected. I am now going to palpate for his carotid pulses. Can you please turn your head to the left? Okay. Turn your head to the right. Okay, carotid pulses are 2+, regular, bilaterally. I palpated the carotid pulses one at a time. I'm now going to palpate for his radial pulses. Can you hold your hands up straight? Thank you. Sorry, maybe I just show the location. And then, thank you. Radial pulses are 2+, regular bilaterally. Mr. Wedderburn, I'm going to reassess your pain again on a scale from 0 to 10, 0 being no pain and 10 being worst pain of your life. Can you please tell me what, if any, pain you're feeling right now?
0.
Okay, thank you. If anything changes, make sure you please let someone know, okay?
Okay.
At this time, I am lowering my patient's bed to the lowest possible state. I'm uplifting his bed rails, and I am placing the call bell right next to him so he has access to it. Mr. Wedderburn, this completes my assessment. If you have any questions at all, make sure you hit your call bell, which is right next to you, to let one of your nurses know that you need something, okay?
Okay. Okay,
the patient's bed is also locked, and I am going to perform hand hygiene before leaving his room. Okay, thank you, Ms. Wedderburn. Have a good day.
Thank you.
So you guys have seen my project for health assessment part 1, my head to chest assessment. What did you guys think? I know I'm real dry and stuff because I was fed up at that point. I just wanted to get it out, get it done. And yeah, I succeeded. Yeah, that's it. It's really kind of embarrassing, but whatever. So that's all for today's video. Make sure you like, comment, and subscribe as I said. And I will see you in my next video. Likkle more.